duplicate prescriptions, making the discontinued medications more visible, requiring verification for double verification for high alert prescriptions, and also requiring additional information to be entered before medication administration when they are part of the prescription. So if there are parameters in place, that information should be added as well and required in order to continue in the EMR. Next, I'd like to discuss the Plan, Do, Study, Act project approach to this case study. So there's a lot of information here, which I will try to summarize. First, for planning, one of the first things that can be done is that the organization can plan a morbidity and mortality meeting with all of the healthcare providers and nursing staff to discuss this adverse event and find what can be done to start talking about discussing what can be done to prevent this from happening. And along with that, it's important to set goals or a plan for the different stakeholders like the pharmacy, the electronic medical record team, nursing staff, and providers, as well as nursing management. For Do, it's important to start developing and establishing and implementing new processes that will help prevent this from happening again. So, establishing a process for the pharmacies to share information when it comes to high alert medications, that's important because whatever process was in place, did not work in this case, did not help prevent the patient's death. Also, one good approach could be requiring additional review of the high-risk medications by the pharmacist at the in-house pharmacy. It's also an example would be, the in-house pharmacist looks at the patient's chart, and that might help with preventing an error like this. Implementing real-time pharmacy alerts when there are duplicates of high alert medications. Also, implementing training and education about safe medication administration for all nursing staff, and then also assessing that knowledge. Medication administration audits for nursing staff, medication prescription audits for healthcare providers for high alert medications. And then very important would also be very important to make changes to the EMR system, such as requiring a secondary nurse verification for high alert medications, giving alerts for high alert medications and for duplicate medication administration, and requiring additional parameters when the prescription requires that to be considered. So, for example, if the prescription said to titrate based on the patient's kidney function, in this case, entering a kidney function marker might be one way to bring that to the attention of the nurse so that the nurse administering the medication, the high alert medication, can more accurately follow the prescription. Next, for study, it's important to evaluate how effective the training for the nurses has been. What has been the trend with the medication administration audits? Does it look like the training made a difference? Are things getting better? It would be helpful to interview the nursing staff about the barriers to safe medication administration after some of the changes have been implemented. And in general, it would be good to have an ongoing survey for suggested EMR system improvements. And it would also be helpful to work with nursing management to identify the barriers in place to implementing all of the changes under the Do section. And that way they can be adjusted and there can be changes that can be made. And then for ACT, once you've gathered all of the different information, You can choose, what has worked the most, what hasn't, and it's always going to be a process of, continually improving the processes in place. But I think when it's important to continue the ongoing training of safe medication administration for nurses and to keep listening to the nursing staff and to providers when they suggest changes to the EMR system that could help them and that could improve patient safety. And it's also important to continue monthly um, audits of high alert medications so that the hospital remains accountable for the in-house pharmacy, quality of pharmacy services, and also so that they are aware of the quality of the pharmacy services for the contracted pharmacy. And then continue training for the pharmacy for them to know what to do if they, find a duplicate prescription. How can they contact the doctor? What can they do? So this is just one approach for how to prevent patient harm. Now for stakeholder analysis, there are a few different stakeholders that were involved in this case study. There was the patient, the prescribing healthcare providers, the nurses, the pharmacies, and the pharmacists. Um, the electronic medical record um, system played a role in it as well, and that would involve hospital IT when it came to implementing changes. Nursing management is also important. And then lastly, hospital administration.